We're pushing the boundaries within the health tech sector by introducing continuous wireless monitoring of patients in the non-ICU ward. So everybody who's not hooked up on a lot of equipment already, those are the ones that we care about, basically. We also split our, let's say, value proposition, if you want to call it that, into a clinical value proposition and then an economic value proposition. The clinical, I mentioned here, by doing continuous measurements, we better the measurements that we do in the hospital ward today. So, for example, respiration rate, it doesn't hold a lot of value when you do spot measurements because that is heavily influenced from the minute to the minute, basically. But by doing it continuously, you can actually see the trend, the graph, the mean. That is what we provide. That's on the clinical side. For the economic side, it's more of, can we liberate the nurses for some of their work that they're doing today? Taking the measurements and putting it into the EMR, the patient journal, that doesn't necessarily need to be done by human hands. It's a trivial task that takes up a lot of time for the nurses that we are talking with today. Now, All-in-One comes in two different variations. We have a standalone device that can be implemented on any old bed. It can be at home at a patient or it can be in the hospital on an older bed frame. And we also come with our partner, Revolutionizing, who is actually integrating our system into their bed frame. So we have a completely wireless setup that is not even touchable by the patient. Now, all the signals that we measure through the mattress is transmitted into the back-end system where it's available for the clinical personnel and in the end getting introduced into the patient journal. So focusing on how nurses work today, can we somehow make that more efficient without actually losing the, as we call it, where I come from, the warm hands on the patient? Nursing is about so much other stuff than actually registering numbers in a system. So can we move that to the machine, so to say, so the machine takes care of noting down all the vitals that we are measuring out there? Then we're taking off a huge load of the nurses that are working today.